You will be treating your lower back, SI joints, and glutes. Sit comfortably while you're bottling and shift into different positions so that you can reach the areas that you are working on. Maintain proper posture and relax your neck, shoulders, and arms while you bottle. Although it's ideal to bottle directly on your skin, you may also bottle over thin clothing. Note that some fabrics may hinder your bottling technique and results. You will need your bottle therapy pain crusher to break down scar tissue and to release adhesions in the fascia. Apply oil to the treatment area. Start your timer and let's begin. Because we will treat the left and right side, this treatment will take approximately 4 minutes. The glute muscles and back muscles must be stretched, so lean forward and ensure your foot is up on a chair. You will always start this routine at the SI joints, the 2 bony bumps on either side of your spine. This is the most important part of this routine, as the back muscles and the glute muscles attach here. Use 2 hands to ensure that both arms stay relaxed. You are using a small detailed grind around the SI joint, bottling with a deep pressure and at various angles. Taking the time to break down the scar tissue in this area is key to getting the results you need for a healthy lower back, hips, and glutes. Really grind or dig upwards with good pressure here. You can now switch to using one hand as you bottle the right glutes close to your tailbone to eliminate or prevent any groin issues, groin inflammation, groin pulls. Please take extra time to work closest to your tailbone. Also, if you've had any tailbone injuries, you'll want to take time to grind down the scar tissue on your tailbone and around it. This area, the piriformis, might require elbow therapy by a family member or friend. However, rolling on a hand weight, micro rolling to release the tension and get a deeper pressure is also very effective. Scar tissue forms around the SI joints because the glute muscles and back muscles get overcontracted, will shorten, and cause micro tearing where the muscle attaches. We're now moving to the sacrum and the lower spine. When you have an injury in your lower back, your glutes, or your hips, you will always work both SI joints because the side that is not in pain or inflamed will always be compensating for the side that is injured. If you have any pain in your lower spine, maybe a herniated disc or a bulging disc, this inflammation is caused by the tug-of-war effect from these muscles pulling on these vertebrae. Releasing the glute muscle in this area will also relieve any sciatic pain. Now, if you have inflammation in your hip flexor, you will also be working both SI joints because in order to release the inflammation in the hip flexor, you must work the opposite SI joint, glutes and hip. This is one of the exceptions to the rule when treating injuries. The trick here is you do not need to work on the painful or inflamed spot to bring healing, unless you've had a direct injury to the hip flexor itself. If you're feeling like you need a deeper treatment, as you may not be able to reach or release this area using bottle therapy, you can book pain coaching for a family member or friend to be trained to elbow safely and effectively. Bottle therapy can be done anywhere, at any time. For accelerated results, follow the Bottle Therapy Formula 235. 2-minute treatments, 3 times each day for 5 days in a row to effectively treat arthritis and bursitis in the hip, bulging, herniated, or degenerative discs, prevention of degenerative cartilage or bone on the hip joint, groin pulls and inflammation, glute pain, hip flexor inflammation, lower back pain, lower spine misalignment, numbness and tingling in the glutes, legs, and feet, prevention of labral ligament and muscle tears, sciatica, SI joint pain, tight piriformis, tailbone inflammation. Now please watch my video tutorial for proper rolling and stretching. To become your body's best therapist, take the time to watch my 6-part 2-minute pain fix educational series. If you're needing in-depth training and a pain-specific treatment protocol, consider booking virtual pain coaching.
I'm Joanna Chase, and I hope you join me in living pain-free every day.
Go to bottletherapy.ca and join the Bottle Therapy movement now.